So my name is Jason Gagne. I am a board certified veterinary nutritionist, and I work at Purina, and I primarily work on the Purina Pro Plan Veterinary Diets brand, even though I interact with all brands. And I am the director of veterinary technical communications. I specifically work with small animals. So dogs and cats. I am part of a team to create diets and renovate diets for cats and dogs with conditions. I also work with a team of experts to build, create, renovate the optimal diet for cats and dogs. So, PhD nutritionists, I work with legal experts, regulatory experts, manufacturing experts, so on and so forth. Kind of like it goes, it takes a village to create an optimal diet, not just me. My field is unique from general practice because I am a specialist, and I think that requires a little bit of a background explanation. So, I graduated veterinary school. I was living in upstate New York, so I went to Cornell. I graduated vet school, went out into general practice for a few years, and I actually really loved working with the individual pet, the cat, dog. That's primarily what I was doing, small animal practice. And I just kind of wanted something a little bit different. I loved working with the DKA and getting the diabetic ketoacidotic back on the mend. I loved working with the hepatic encephalopathic dog and getting them out of that state. Um, it's kind of like an instant gratification. But I wanted something more on a population level, and I have a love of math and biochemistry. I know that sounds weird, but I do have a love of math and biochem, and at its heart, nutrition is math and biochem. And to do that in nutrition for me was to go into industry and go with a pet food company. Research in pet food is extremely important. I would say research in veterinary medicine is extremely important. It's not just within pet food, because our profession of veterinary science is just that. It is based off of science, and we need to provide evidence-based medicine to show that it works. As technology advances in veterinary medicine and we're able to improve diagnoses potentially at earlier stages of disease, that could lead to renovations and or innovations of pet foods. And therefore, we have to continue to perform that research, providing the efficacy data that the products provide the benefits and that we have the best diet possible to complement a veterinarian's treatment plan. My role is kind of amorphous as a nutritionist at Purina. I collaborate with all brands to some degree at Purina, but I primarily stick with the Purina Pro Plan Veterinary Diets brand. So I will work with the R&D department, some brilliant minds in that department, and I will work with them maybe to develop their hypotheses and study designs for a proof of concept study. That may take some time, some in terms of years at times, to do a proof of concept study. And then once that proof of concept study is done, I may engage key opinion leaders in the respective field to do a clinical trial with said diet, supplement, whatever it may be. And that may take a couple of years. And then after that, if we get statistically significant, clinically significant, more importantly, and relevant results, I may take that product to another level and say, okay, we're interested in bringing this to life. And at that point, we call that the innovation and renovation pipeline, or the INR pipeline. And that may take a couple of years. So you can see where the timeline is really adding up here to the development of a product. And at that point, I will begin to work with the PhD nutritionist to help set nutrient parameters and say, for example, how much protein do you actually want in a feline early stage chronic kidney disease diet? How much phosphorus do you want in there, or sodium? So I will work with them to do that. I will then take that and we will then work with manufacturing folks, because as you can imagine, up until this point, we may be dealing with something more on paper or in a database more specifically. It's one thing to create a diet on paper. It's another thing to say, can it come to life? And the manufacturing folks are brilliant folks as well, product specialists, process engineers, and they're the ones that are saying this is how, based on these ingredients we're using, how it should flow through machinery. Product specialist is saying this is how it should look when it's complete. And then, of course, you have a quality assurance specialist who is saying, yes, it meets our specifications. Once that is done, and now we actually have a product, I will work with a marketing department to help develop their launch plans, communication, national, regional conferences. I will work with them to also develop their collateral, product guide pages, detailers, so that Salesforce can use pieces of collateral to then speak to veterinarians in practice and explain the results of our study and the benefits of a diet or a supplement. And then I will also help to train that Salesforce as well. So again, it's kind of an amorphous role, but I work as a liaison, if you will, to tie a bunch of departments together to be able to speak to general practitioners more effectively. So probably the most interesting experience in industry as a veterinarian is really to partake in the research, no one product or supplement in particular, but to partake in the research and have that experience of bringing something to life and knowing that it could benefit a pet and being able to achieve what I set out to do and feed the masses, and as a vet to be able to provide a benefit to them. It's a very rewarding experience to be on a brand that provides a diet to a pet, say for example an orthopedic pet, and to give them a diet, a joint mobility diet, let's say, that has a high amount of omega-3s, added glucosamine, etc., that then can provide a benefit to get that pet more active and to have that owner feel, just see the difference and feel better about their pet. It's very rewarding, and it's important for us as vets in general. I don't care whatever specialist you are. It's important for us as vets to get that positive feedback. When you come across a pet that has competing nutrients of interest. So, for example, a cat with renal disease and diabetes. So, renal disease, to some degree, you're going to want to lower that protein. Diabetes, it's actually been shown through research that raising the protein is a good thing because you're dealing with a true carnivore and limiting those carbohydrates. So, again, that right there to kind of find the balance of what is the greatest nutritional benefit for that pet, that would probably be a large challenge. Getting pets to eat is, of course, another one. Sometimes, it's one thing formulated diet on paper. It's another thing if a dog or cat eats it. What keeps me going on a day-to-day basis is knowing that I am providing diets that have a great benefit for pets. That the diets that I help to create or renovate provide a treatment for a general practitioner or a specialist. And knowing that we have the efficacy data to support that and being able to work with a team of experts at my job, it's a win-win. The advice I would give somebody that is interested in this field is I would encourage them to speak with a variety of nutritionists. Again, we all have different experiences, whether it be private practice, academia, industry, etc. Speak with them, find a mentor, understand that it's a rather long undertaking and a journey, but it's well worth it. I would tell people to check out Purina.com, very informative website. You can see how we are always looking to provide information to owners, to the veterinary profession as well, showing that people are better with pets. I would tell people to check out the acvn.org, the American College of Vet Nutrition website. There's a bit about our college, our mission to disseminate knowledge to the veterinary profession, frequently asked questions, information on consultations, residency programs. So it's a very informative website, but I would get in touch with a veterinary nutritionist in the variety of fields and see what interests you the most.